Hello everybody and welcome to Bread and Butter Primary Care. I'm Dr. Stokes and this video is entitled What is a Stroke? A stroke is something that is very feared. It's something that can really change your life permanently because of the results that can happen when a stroke occurs. If you've seen the previous videos, we talked a little bit about what a heart attack is. A stroke essentially is a heart attack, but except instead of the blood not getting into the heart, the blood is not getting to the brain. So if you haven't seen the previous video, let's use the same example. If you have a finger, here's my pointer finger, and it can move and it can do things because the muscles in this finger are functional. Now they need blood to do that. So the heart pumps blood into the arteries that travel up the neck, down the brachial arteries, down my arm, and they deliver blood and nutrients to the end of my finger so it's able to move and do the things that I want it to do. If you were to interrupt that blood flow, say with a blood clot or something, then my finger would not get the blood supply, and you could call that a stroke of the finger. Okay? And so what happens with a stroke is your heart pumps, the blood goes up the carotid arteries, up your neck, into your brain. It's one of the first things that the heart feeds with blood is the brain. So there's a large artery, the carotid, that goes up, and then it branches into smaller arteries that go and they feed all the parts of the brain. Now those arteries that feed all the little parts of the brain get smaller and smaller as they branch off. And so what happens in a stroke is you get a cholesterol plaque or a blood clot or something that travels up the arteries, and it gets up to a section where the artery is too small for the clot, and it stops the blood flow. And whatever's downstream, whatever little piece of the brain was downstream from that clot, that tissue begins to die. And whatever function that tissue participated in goes away. And so strokes can cause literally almost any symptom. In one of my very first rotations as a medical student, I did a neurology rotation at the hospital, and during the same week we had one person who was admitted with a stroke in which they had no function from their shoulder to their wrist. Was completely weak. They couldn't move it at all, but their hand was completely normal. Their grip strength, movement of the wrist, absolutely normal, but they couldn't move anything from the shoulder down to the wrist. The person literally next door in the next room had a stroke, and they could move their arm except their hand was completely gone, and so they couldn't move anything from the wrist down. No grip strength, no finger movement, but their arm movement was fine. And so it was an interesting situation where you had two people with the exact opposite findings, and just because the stroke was in a different place. Okay, so in the person who couldn't move their fingers, the little artery, the little piece of brain that didn't get its blood supply was the piece of brain that controlled the fingers. The person who got it where the arm wasn't working, the little piece of brain that lost its blood supply was the part that controlled the arm. Okay, and so that's what a stroke is. It is the cessation of blood arriving to a part of the brain, and whatever that piece of brain controlled will go away. Okay, so signs of a stroke is loss of strength, loss of sensation, droopy face, loss of function of some part of your body is a sign of a stroke, and you should get help immediately. So there'll be other videos. We'll talk more about how to prevent strokes, what to do if you've had a stroke, but I wanted this just to be a brief, simple video about what a stroke is. So I hope that helps you understand what it is. Stay tuned for more videos similar to this one, and I hope you guys have a great day.